Hi everyone, my name is Melanie Elagolix for have a menstrual bleeding in women with uterine fibroids. Definition: uterine fibroids are hormone-sensitive eggs in the blood that are related to have menstrual bleeding. Elagolix and oral gonadotropin, releasing hormone antagonists that produce rapid and reversible suppression of ovarian sex hormones, can reduce bleeding associated with fibrosis.
Hello, my name is Dr. David Archer, and I will be discussing the results of this Phase 2A proof of concept study investigating the gonadotropin-releasing hormone antagonist Elagolix in the management of heavy menstrual bleeding associated with uterine fibroids. Uterine fibroids are the most common benign tumors affecting reproductive age women, and although patients are often asymptomatic, the disease can present with heavy menstrual bleeding, which is the primary indication for hysterectomy. These tumors are estrogen and progesterone dependent, and hormonal modulation is a mainstay in the management of the disease. However, there is no FDA-approved long-term treatment for heavy menstrual bleeding in women with fibroids in the United States. The serum levels of estradiol and progesterone are tightly controlled by the hypothalamic pituitary axis. Hypothalamic gonadotropin-releasing hormone is secreted in a pulsatile manner from the hypothalamus. After binding to receptors in the anterior pituitary gland, the two gonadotropins, luteinizing hormone and follicle-stimulating hormone, are secreted into the peripheral circulation and stimulate the ovaries to produce estradiol and progesterone. Elagolix is an orally active non-peptide gonadotropin-releasing hormone antagonist that leads to a dose-dependent suppression of gonadotropins and sex steroids. This hormonal suppression is rapid and reversible, and the degree of suppression can be controlled by varying the dose. The objective of this study was to evaluate the safety and efficacy of Elagolix versus placebo with a combination of low-dose estradiol and progestogen as add-back treatment. Reproductive-aged women with a diagnosis of heavy menstrual bleeding due to uterine fibroids were treated with various doses of Elagolix with or without add-back versus placebo for 3 months. It is worthwhile to note that this is the first study to evaluate estradiol and progestogen add-back therapy in combination with either a gonadotropin-releasing hormone agonist or antagonist in women with uterine fibroids. The menstrual blood loss, measured by the alkaline hematine method, decreased in a statistically significant dose-dependent manner compared to placebo with the 300 milligram, 200 milligram, and 100 milligram twice-daily doses of Elagolix. The add-back did not alter the decrease in menstrual blood loss compared to Elagolix alone. Given its mechanism of action, it was not unexpected that hot flushes were the most common adverse event associated with Elagolix. 56% of patients in the placebo arm experienced an adverse event in this trial, with higher rates of adverse events in all of the Elagolix treatment arms except one of the add-back regimens. Add-back regimens appeared to decrease the rate of hot flushes as well as the discontinuation rate. In conclusion, Elagolix is an oral non-peptide gonadotropin-releasing hormone antagonist that suppresses the pituitary-ovarian axis and significantly reduced the amount of menstrual bleeding in the study participants. Of the study dosing regimens, the 300 milligram dose taken twice daily had the greatest efficacy. Indeed, this dose was selected for the subsequent Phase 2B and Phase 3 studies. Hypoestrogenic effects were seen in a dose-dependent manner. However, the add-back regimens reduced the extent of hot flushes with minimal impact on bleeding. Consequently, Elagolix is a promising medical treatment for heavy menstrual bleeding associated with uterine fibroids that warrants further study in Phase 2B and Phase 3 clinical trials of greater duration.
Application in nursing. Uterine fibroids are clinical evident in approximately 25% of women, but might be present asymptomatic in about 70% of women. In particular, the incidence of uterine fibroids is 2-3 times higher among Black women than among white women. The main symptom of uterine fibroids is heavy menstrual bleeding. Additional symptoms include pelvic pain and pressure, urinary or gastrointestinal problems, such as frequency and difficulty emptying or constipation or infertility.
My name is Susie Asani, and I'm the director of the Minimally Invasive Gynecologic Surgery Program at the University of Michigan. Today we're going to be talking about abnormal uterine bleeding, which is a very common condition that affects many women in their reproductive years. Abnormal bleeding is any type of bleeding that is irregular. That could be bleeding in between menstrual cycles, bleeding that is heavier than usual during menstrual cycles, bleeding after intercourse, or even bleeding after someone's gone through menopause. There are many different causes of abnormal bleeding, and some might be due to hormonal changes, some might be due to structural abnormalities such as lesions within the uterus, and others might be due to systemic medical conditions. When a woman has a menstrual cycle that occurs greater than 35 days from start to start, less than 21 days from start to start, or bleeding in between their menses, after intercourse, or after menopause, these are all indications that something might be abnormal and she should be examined by her physician. Uterine fibroids are a common cause of abnormal bleeding, and the lifetime risk of developing uterine fibroids is approximately 70 to 80%. Uterine fibroids are benign tumors of the uterus and can cause many symptoms such as abnormal uterine bleeding, which can be either heavy or irregular, pelvic pain, and/or pelvic pressure related to the large size of fibroids. However, not all women with uterine fibroids have symptoms, and the decision to proceed with treatment for uterine fibroids really depends on whether or not those symptoms are bothersome. If you think that your bleeding symptoms are abnormal or bothersome, or if you suspect that you might have uterine fibroids, you should talk to your doctor to be evaluated and to see what treatment options might be best for you.
Pros and cons. Women with heavy menstrual bleeding associated with uterine fibroids don't have a safe and effective treatment option beyond surgery. Elagolix is oral gonadotropin-releasing hormone antagonist that suppresses ovarian sex hormones. Elagolix works quickly, suppresses hormone within 4 hours of starting treatment, and with a short half life can be also restored.
And I'm an interventional radiologist at Wake Forest Baptist Health. Uterine fibroids are benign tumors of the uterus. And what that means, benign means they're not cancer. They don't spread throughout the body. They don't kill people. Tumors mean that they're abnormal growths. So basically what they are is the wall of the uterus is made out of muscle cells. And just like any other part of the body, those muscle cells will turn over. And for whatever reason, nobody knows for sure, in the uterus, some of those muscle cells will start to grow abnormally into a ball of cells, which becomes a tumor, and that's the fibroid. Uterine fibroids are extremely common. All races of women get them, but it's thought that African American women get them more commonly. In fact, up to 75% of African American women are known to have uterine fibroids. The interesting thing is that the vast majority of women don't realize that they have uterine fibroids because they often don't cause any symptoms. The important point to realize is that if uterine fibroids are not causing any symptoms, they don't need treatment because these are benign tumors. However, when they do cause symptoms, those symptoms can be quite significant. There's basically two main categories of symptoms. There are symptoms associated with bleeding, and there's symptoms associated with the size of the fibroids or the bulk-related symptoms. Most commonly, women become aware of uterine fibroids due to bleeding. And the way this bleeding presents is either heavy menstrual cycles, prolonged menstrual cycles, or irregular menstrual cycles. With respect to bulk-related symptoms, typically when these fibroids go to be a large size, they can cause pain, cramping. Oftentimes women can even feel them and feel like they're even pregnant. Often these fibroids can grow so large that they will push on other organs within the female pelvis. For example, they typically will grow and push on the urinary bladder and compress it. Because the bladder becomes compressed, women have the sense that they need to urinate frequently. Oftentimes patients will come to me and tell me that they need to urinate every hour, even though they really don't have to. They have that feeling because the fibroids are pushing on the bladder. In addition, the fibroids can push on the intestines and cause significant constipation. In addition, many women state that once the fibroids become a certain size, they also have pain associated with sexual intercourse.
Issue applied to Ecuador, where we conducted two identical double-blind randomized placebo-controlled phase 3 6-month trials, LRs 1 and 2 uterine fibroids to assess the efficacy and safety of Elagolix as a dose 300 milligrams twice daily with an hormonal therapy. To replace reduced level of endogenous hormones, in this case estradiol 1 milligram and norethindrone acid 0.5 milligram once daily in women with fibro-associated bleeding.
Hello, I'm Dr. Nupur Sood. I'm an obstetrician, gynecologist and a gynec laparoscopic surgeon. I have been practicing for the last 12 years and at present I am heading the Department of Gynecology at Narayana Hospital, HSR. So fibroids sometimes can be very nasty. They cause very heavy bleeding and you are younger in age, less than 40 years. So what should you do? Well, you should discuss that options which are possible, and the best would be first to go in with medications. But as we understand, if it's only fibroid which is causing it, then this removal of the fibroid alone will cure the problem. You need not go for a complete uterus removal at that stage. And along with that, certain sort of hormonal therapy and drugs are available to help you deal with this kind of a dysfunctional bleeding without removing the uterus at an age when you would like to preserve your normal ovarian function and maintain a healthy uterus within also.
Conclusion: uterine fibroid can significantly alter a patient's quality of life, causing pain and boil symptoms that affect every time from sexual health to social well-being. Elagolix with additional therapy is effective in reducing menstrual bleeding in women with uterine fibroid. Thank you.
Many women have uterine fibroids.
Uterine fibroids are benign, non-cancerous tumors that form within the uterus from an overgrowth of connective tissue and smooth muscle. And they're actually very common within women who are usually premenopausal.
Dr. Erica Navel-Kepsel says symptoms include heavy bleeding, anemia, difficulty emptying the bladder, and pelvic pain or pressure.
We do have a variety of options to help us treat uterine fibroids.
Treatments range from medication to surgery. One less invasive option is uterine artery embolization. Doctors access the fibroids via catheters inserted through a small artery in the groin or wrist. Once there, they fill the fibroid with contrast to make sure they're in the right spot. Then they deliver small particles that plug up the tiny arteries feeding the fibroids.
Once these tiny arteries are cut off or plugged up, the blood supply to the fibroid is gone and the fibroid shrinks.
For the Mayo Clinic News Network, I'm Vivian Williams.